Are you suffering from weak and tight hip flexors with difficulty engaging your pelvic floor, such as latchkey bladder? When you laugh, sneeze, and cough, you have a leak. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. Join me and my beautiful daughter Bella for this lovely Pilates yoga flow using the foam roller to help the tightness and weakness of your hip flexors that has a big impact on your pelvic floor. So if you've been sitting a lot, or if you have no engagement of your hip flexors due to pain as well and tightness, I'll show you and demonstrate on how to strengthen, and not just stretching your hip flexors. It's a combination of strengthening and lengthening program using a beautiful foam roller. So I have launched a pre-sale of my own foam roller that I meticulously designed after 1 year. Because most of my patients in the clinic, they've been complaining on their own foam roller that's very hard, that hurts their back, and that's why I made a 3-inch diameter, and I also have a 6-inch diameter that you can check out on the description below, or comment foam right now and check out the link. We have a pre-sale 25% off for the Black Friday all the way until December 15. So don't miss out on this pre-sale. It's a limited edition, so can't wait for you guys to try it. So in this video, we're going to start lying on your back with the foam roller underneath your pelvis. And if you don't have a foam roller, you can still join me by using a roll towel, or you can use a prop-up pillow to place on your pelvis, not on your lumbar spine and not on your hamstrings. Are you ready, Bella? So it's important with the gravity-assisted foam roller. This will help your hip flexors that's very tight to slowly be lifted together with your pelvic floor like a basin, that they interact together. When you're so tight on your hip flexors, it's usually hard to engage it. So it's important to get the support with the foam roller. So from this position, place your hands on your abdomen, Bella, especially in the lower abs. And you want to make sure you breathe in through your nose and expand your abdominal muscles. That will help the basin of your pelvic floor. And then as you exhale, zip it up, like blowing in a small straw as you zip up a tight jean from your lower abs to your navel. And this will help prevent the downward pressure down your pelvic floor. Again, inhale, exhale, zip it up. Last one, inhale, exhale, zip it up. After the beautiful breath work, now we're going to start marching. You can hold on on the foam roller for absolute beginners. As you breathe in, exhale, slowly lift one leg up to tabletop. 90 degrees, like if you place a cup of coffee on the top of your leg, it won't spill. Not too high and not too low, just 90 degrees on your hip and knee. And then inhale as you go down. Exhale, zip it up and lift. And then breathe in as you go down, slow and steady. Exhale, zip. Squeezing your core in. Inhale. Exhale, switch. Slowly warming up your hips with your breathing like an engine, like a piston motion with your pelvic floor. Inhale down, exhale, zip. Breathe in and breathe out. And last one on your right. Well, then now we're going to do a gentle hip opening after tabletop. And breathing out, we're going to slowly open your hip out to the side without twisting your spine, keeping your pelvis centered. If you place a cup of coffee on your abdomen, you don't want to spill to the left. You want to keep the cup center. Inhale, back center, and then exhale down. And then switch to the other side as you breathe out. Inhale as you open. And then exhale, back center, and zip it out. Breathe in. Before lifting, you exhale. Inhale, slowly open. And then exhale, center, all the way down. Inhale, exhale, lift. Always exhale with exertion. Inhale as you open. Exhale, center. And then down. And last set. Feels so good on the hips, right, Bella? You feel it on your hips? And last one on your right. Well done. After this last tabletop with hip abduction, now we're going to slowly lengthen your hamstrings after the tabletop. And breathe out. And slowly lock your knee, toes pointing to the heavens, and breathe out. And then breathe in again as you go back to bend to tabletop. Exhale down. And then switch to the other side. Especially if you have diastasis recti, you don't want to see any doming or coning on your abdomen. You want to slowly build the strength of your core. Breathe in and breathe out. Inhale, exhale. So far, so good, Bella. You feel the stretch? You're getting better, right? With your toes pointing to the heavens as you extend. This will help strengthen your hip flexors, slow and steady. 2 more to go. Breathe in, breathe out. Always engage your breath work. Don't hold your breath. Last set, my friends. Feels so good to lengthen. And last one on your right, my friends. Well done. Now lift both legs up to double tabletop. And from this position, you can hold on to the foam roller. As you breathe in, exhale, gently tap one foot at a time. With just your toes, not the whole foot. And then switch. You don't want to just tap it too close to your body, a little bit away from you to really engage your hip flexors. Because if you tap too close, you're just tapping it down. You want a slow, controlled, like keeping your knee to tabletop 90 degrees as you breathe out. Inhale, back center, and then exhale, tap this time because you're exerting more effort as you tap. The slow, controlled movement without any plopping or sound. Because when you have more control, you have to do slow and steady. Last set. Now we're going to have variation as you tap and go up and then extend the same leg and then back to the center and then tap the opposite leg. And then go back center and then extend to lengthen, bend, and then switch to the left. Back to tabletop and then extend to lengthen. And then right foot, tap, center, and then extend your right leg. Again, left foot tap, extend, back to tabletop, and then switch to the other side, right foot, and then extend, and back center, and then your left foot tap, bend, extend. Well done. 4 more. And then bend, extend, and then right foot, extend, left foot tap, extend, right foot tap, extend, last set, left foot, extend, and right foot. Well done. Now I'm going to hold that double tabletop. Now we're going to extend one leg. And from this position, you're really strengthening your hip flexors, and we'll do a small circle like the size of a small dish without rocking your hips. Slow, controlled motion as you breathe in and breathe out. Inhale, exhale. And then reverse circles. Reverse the circles with your breath work. You're going to engage. You can feel it on your quadriceps all the way to your hip flexors. and then bend back to tabletop. Switch to the other side and then circle. Like a size of a small dish without rocking your hips. Toes pointing to the heavens. Lengthen and stretch. Slow, controlled. If it's hard for you to control, you can place one foot down for more stability. But if you want to challenge, keep it up in tabletop and then reverse circles as you breathe in and breathe out. Well done. Now, after doing that, switch to the left foot now. Hold this position, keeping the other knee in tabletop. We're going to slowly lower one foot to the side. This will help lengthen your hip adductors that will eventually support your hip flexors because it feels good to lengthen as you breathe in and then breathe out back to the center. Inhale, exhale, lower, slow and steady without twisting your spine. Inhale, exhale, slow and easy. Breathe in, breathe out. You can also challenge by lifting your hands up to the heavens so that you can really feel the engagement and lower your hand as well on the same side. Inhale, exhale. Breathe in, breathe out slow and steady as you go down. Inhale, exhale. Now switch to the other side. Extend your right leg and then lower your right foot to that other side. Inhale, exhale. Keeping your core engaged. Breathe in, breathe out. Inhale, exhale, open. 2 more. Breathe out as you lower, keeping the other leg stable. Last one. And the last exercise is legs raise. Inhale, exhale down. And once you reach down, you breathe in and breathe out up. Dorsiflex as you go down for a deeper stretch, which means toes pointing towards you. As you breathe in, breathe out down. Inhale, toes pointing away and then lift. And then dorsiflex and down. Tippy toes, toes pointing away. Exhale as you lift. Inhale again and then dorsiflex as you go down. 4 more. And then exhale down. Inhale and then exhale up. Inhale, exhale down. Inhale, exhale up. 2 more. Last one. And then switch to the other side. Extend your right leg this time as you breathe in. And then dorsiflex before going down. Tippy toes before lifting. Engaging your hip flexors. 4 more. 3 more. 2. Last one. And 1. Well done. Now we're going to slowly remove the foam roller. We're going to start rolling and kneeling position. We're going to stretch your hip flexors. And now we're going to do some beautiful hip opening. You can start one leg up forward like this. And you can use the foam roller as a guidance. You can challenge it also for stability with your foot. Like this. You can start with your left foot or right foot. Okay, I'm going to start with your left. So you feel that instability, right, Bella? As you breathe in, you're going to slowly lean and get that foam roller stable. The arch of your foot, you're going to feel the hip opening on your left. with your breathing. And you can hold on to the foam roller if you like for stability, Bella, like this. And then inhale back center and extend your leg to stretch your hamstrings, and then back for a hip flexor stretch. Feels so good, right, Bella? Inhale. Exhale, extend as much as you can, keeping your back straight, and then forward. 2 more. Feels so good to lengthen. Last one. Well done. Now let's switch to the other side. I'm gonna place my left foot this time, keeping my back straight. Slowly lean forward first. Feel that stability and balance. It's nice to have a soft foam roller to grab, and then hold to the foam roller if you can, and then extend. It's dynamic stretching, so it's good to trick your brain to lengthen slow and steady as much as you can. Hamstrings and hip flexors, they go hand in hand, so it's important to keep them strong and healthy. Last set. And that's it. I'm hoping you enjoyed this hip opening, strengthening your hip flexors using the foam roller to help gravity assisted. If you love this video and you want to learn more about Pilates, yoga, and physical therapy, please subscribe to my channel, ring the bell so you won't miss anything. Like and share this video. Every like you give it to my channel, you are supporting me. Thank you, Bella, for joining me today. Don't forget, I have my foam roller. Check out the link down below and get the pre-sale right now with 25% off. And if you have more time today, try this hip opening yoga flow. This video is my lovely hip strengthening program that will help your diastasis recti and your tight hip flexors. Until my next video training, always remember, be safe, be well, and healthy you. Bye!